Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. As always, this is your chance to get your COVID questions or any other public health questions answered live. Today is Tuesday, November 22nd, 2022, and this morning I got my bivalent booster. Some of you know that I had COVID in late August, and the CDC says you don't have to wait up to 3 months after getting COVID, but you can. I chose to wait. I was monitoring what was happening with variants, and given that everything was still Omicron, I chose to wait those 3 months. And so I was very pleased to get my COVID booster this morning. I got it down at the CVS on South Pulaski in the West Lawn neighborhood. We were there with our lead Healthy Chicago Equity Zone organization for the Southwest. It's called SWAP, the Southwest Organizing Project, and a lot of the folks that are out there every single day educating people about vaccines, making sure that we're getting past all barriers and working on other health issues were there as well. So I'm very pleased to have now had both my flu vaccine and my fall 2022 COVID vaccine updated and just in time for heading into the holiday season. So as always, let's start with our COVID dashboard. This is at chi.gov/COVID updated Monday through Friday. And just as a reminder, you can put questions directly into the box below, or you can use the hashtag AskDrArwady on either Facebook or Twitter. We'll present some information and then take your questions in the second half. So if we look at our dashboard, we are doing okay. We are back at a low COVID-19 level. I'll show you the details on that in a minute. We've been right on this borderline between low and medium. The main thing is I want to avoid high if we can. So you can see lab confirmed cases down just a touch, but really essentially stable. We're averaging around 400 new laboratory confirmed cases a day. We know there are many in Chicagoans. We know there are many, many more than that in people who are just being self-diagnosed at home. But just for some context, whereas about 400 a day is our current number, if you look back to late December last year, see this? There was a day we had more than 10,000 Chicagoans with a lab-confirmed case a little more than a year ago. So that's good progress. In terms of hospitalizations, we're, again, pretty stable from last week. There are 31 Chicagoans being newly hospitalized with COVID every day. You can see this has really been relatively stable for the last number of months. Again, that 30 a day compares to, if we go back to right around the end of 2021, beginning of 2022. See, there's a day we had 306 Chicagoans hospitalized in a single day. So we're at about 10% of that right now. In terms of deaths, we're averaging still less than 1 death per day. We have had more than 7,900 Chicagoans die from COVID. It's very much not over, but you can see that the deaths, too, have been relatively low since that main Omicron surge. And the reason, the biggest reason for that is, of course, the vaccine. In terms of vaccines, we're doing a little bit less than 5,000 vaccinations on average every day. This is the average over the last 7 days. We've done almost 5.6 million vaccinations in Chicago, and almost 80% of Chicagoans have had at least a single COVID vaccine. Our emergency room visits are a little bit less than 2% of all visits are testing positive for COVID, so that's relatively stable. And our hospital beds in use are under 5%, really at 3.5% of all of our beds in Chicago are taken up with COVID patients. So not gone, but in okay control right at the moment. I also just wanted to show you, we've been getting a fair number of questions about variants, and I will show you the details, but I wanted to remind you that, these buttons down here, you can click and really explore a lot more in detail. So if you want to see more about variants, for example, if you just click on this box, it'll bring you to, there's some teaching about what are variants, how we find variants, how are variants classified. There are these different variant being monitored just means something we're paying attention to, variant of interest, is of some more concern. A variant of concern is the one we would really be worried about. Variants of concern are what get those letters like alpha, beta, delta, Omicron, and the reason something is labeled a variant of concern is it's really different than what's come before. It spreads more easily. It causes more severe disease. And then a variant of high consequence. We've never had a variant of high consequence, but that means basically if the vaccine weren't working or treatments really weren't working, nationally or internationally, we could designate something a variant of high consequence. If we got a variant of high consequence, really all bets would be off in terms of being able to predict. But at this point, all of the variants in recent times have been variants of either variants being monitored or variants of interest, and that's pretty good news. You can come down here and click really week after week and get a sense of, these are all the subvariants, these are all Omicron. But if you highlight, you can look, for example, what's been happening with BA.5. And if you just hover over that, it'll show you what's been happening with BA.5. And you can look at this nationally or regionally. Chicago data is all included in this. And you can see when I hovered over BA.5, it gives you a sense of how connected are they to each other. If you come down to this part and you can hover and it'll show you just here. Let me shrink this a little bit if I can. Well, maybe I can't on this screen, but here we go. So like if I just want to look at BA.5 and I hover over BA.5, you see how BA.5 then also highlights on the graph below. Depending on the computer you're on, it shows up slightly differently, but you can get a sense pretty quickly of what's happening with different variants in different parts of the country. No major new concerns this week, but I know a lot of you are very interested. So there's lots of details here. Every week we're putting out, there's downloadable reports, there's lots happening on the variants front. So I just wanted to show you as one example. And if you're interested in hospital capacity, you're interested in wastewater surveillance, you're interested in community risk and transmission, vaccine coverage, vaccine effectiveness, all of that is down here. And the data portal is where you can download the information and explore for yourself. The Health Atlas is where all of our health data goes, not just COVID. So I encourage you to explore that as well. Okay, so let me turn just to a short presentation here, answering some of the questions. So first of all, I wanted you to know that this week is actually Antibiotic Awareness Week, November 18 to 24. But I did think I would just take a moment because I feel like Chicagoans have been paying more attention to infectious diseases recently. And you might wonder, why haven't you heard that much about antibiotics for COVID? It's because antibiotics specifically they don't treat viruses. They treat infections that are caused by bacteria generally. So strep throat is caused by a bacteria. A urinary tract infection is caused by a bacteria. Pneumonia is caused by a bacteria. And so the antibiotics treat infections that are caused by bacteria. However, antibiotics do not treat viruses. So most bronchitis is caused by viruses. Most sinus infections are often caused by viruses. Even some ear infections are caused by viruses. And so you might remember, going to your doctor, going to the pediatrician, and the doctor will say, I think this is a virus, so you don't need an antibiotic. That's not just the doctor not wanting to give you something. It's the doctor knowing that the antibiotic will not help with a virus, but that also if we're not using antibiotics appropriately, if we're using them when it's not a bacterial infection, we actually see the bacteria mutate to be able to better fight off our antibiotics. And so this problem of mutation that you hear us talk a lot about in the context of COVID or influenza, the bacteria also can mutate. And if you hear of something called antibiotic resistance, that's where you lose the ability to treat a bacterial infection because the treatment that we have, the antibiotic, doesn't work. MRSA is probably one of the ones you might have heard of there. That MRSA, M-R-S-A, it stands for methicillin, that's an antibiotic, methicillin-resistant Staphylococcus aureus. Staph aureus is a common skin bacteria, but the bacteria, the Staph aureus, has mutated to the point where the antibiotics, methicillin and other antibiotics that are similar to methicillin, won't work against this common skin infection. So anyway, it's U.S. Antibiotic Awareness Week. I would encourage you to read some more about that if you're interested, but know that antibiotics do not treat viral infections, which is why we don't give them for COVID or for flu. Instead, we give antivirals. Speaking of flu, lots of flu happening. This is the most recent week across the U.S. You can see that the Southwest in particular and moving up are all in this very high influenza activity level. And Illinois is starting to get into that high range. You can see there's just a little bit of the country left in green, but I expect that darker purple to continue to spread over the next couple of weeks. And across the U.S., this is what really has people concerned. If we look at outpatient visits, so this isn't hospitalizations, this is just people going to the doctor, the urgent care, the pediatrician, et cetera. What percentage of outpatient visits are people coming in for a respiratory illness, meaning, problems with fever and cough and sore throat and runny nose, that if you look, each of these colored lines shows you the percentage each year of the visits that have been for respiratory illness. And you see that this spike for us is very early. This is showing you weeks of the year. So this is weeks 40, 44, 46 of the year. There being 52 weeks in a year. And this is by far the earliest spike and one of the fastest rising spikes that we have ever seen. In dark green there, I'll point out that 2019-20, that's when COVID really hit. So you see how quickly it increased there, but it was later in the calendar year. And this has been really pretty early and sharp for respiratory illnesses. And if we look at the percentage, if we look at that same data by age, you see that it's really the littlest kids driving the most of this. In 0 to 4-year-olds, now more than 15% of the visits, the outpatient visits, are for respiratory illness in that group, followed by 5 to 24-year-olds, although it is rising in all age groups. So this is why, all of these respiratory viruses right now are circulating a lot in kids. If we look at influenza specifically, we look at what percent of the tests that come in to clinical laboratories, meaning if you go to the doctor and your laboratory gets sent to the hospital lab or to Quest or to LabCorp, to any of these, those are all reported in aggregate. And so you can see this most recent week on the right there, about 13% of the tests coming in are positive for flu, which you can see is pretty high. And almost all of it is flu A as opposed to flu B. That's good news because so far it's looking actually like a very good match for our flu vaccine this year. If we look at Chicago in particular, this is lab-confirmed influenza hospitalizations. So people not just who get the flu, but who are sick enough to be hospitalized with the flu here in Chicago. And you see the red there on the bottom left. Again, week 44 is pretty early in the year. You can see most years we see flu take off more in December typically, in that week 50, 51, 52, the very end of the year. But it's already starting here. And already starting to go up relatively quickly. So get that flu shot if you haven't. And then also specifically in Chicago, if we look at kids, what's happening for hospitalizations in children with respiratory illnesses. So this graph shows you on the left, January 2021, and then on the right, the most recent week. And you can see that light blue line is everybody who is admitted, all kids, for just an acute respiratory problem, whether that is RSV or COVID or flu or any of the other viruses. And so you can see we have by far the highest number of children hospitalized with respiratory illness that we've had in the last 2 years and even longer. A lot of that has been driven by RSV. That's this respiratory syncytial virus in red underneath it. It does look like we may have seen the peak of that, thankfully. But it's still very, very high, much higher than it's been at any point in the last 2 years. And then you see at the bottom, this purple influenza is just starting to tick up. So the concern is we really need to keep kids out of the hospital with influenza. We don't have a vaccine for RSV in the same way. So gray is COVID and blue is influenza. And it's really important that kids of all ages, age 6 months and up, should get that influenza vaccine every year. Age 6 months and up should get the COVID vaccine. Because we need the vaccine preventable illnesses to stay relatively low, given how much morbidity, meaning people getting sick, we're seeing already from these other viruses. And also, this is just emergency department visits for RSV. You see very, very high, much earlier and much higher than we've been in prior years. So on to COVID, our risk is back at low, which always makes me happy. Remember that the main point that we're watching on this, both for the city of Chicago and then for Cook County, is this hospitalization number. And we do report out just for the city of Chicago, but also the CDC, when they calculate these, they're calculated at the county level. And for hospitalizations, they include the whole region hospitalizations, because if you have DuPage or Lake or another county really running out of hospital beds or having lots of admissions, that of course will impact Chicago and suburban Cook hospitals. And so it's really that Cook County hospitalization number that's circled in red. That's the one that keeps being close to the goal. The goal is to stay under 10, but if that goes back over 10, we would once again go back to the medium level. Just a reminder that 79% of the people who have died from COVID in Chicago are unvaccinated, and the huge number of people, people who are unvaccinated still much more likely to be hospitalized and much more likely to die, and that's in our vaccine effectiveness data on the webpage. This is last week. You can see 3% of U.S. counties in orange there were at a high COVID level, and 17% were at a medium level. We were back to green. So just a reminder that if you're going to be traveling for Thanksgiving, for example, and you're going to one of these counties that is high, you really need to be careful. Masking where you can. I would think about testing ahead of gathering. Know that that means there's a lot of COVID there, and that also that hospitals are starting to get stretched in those counties. So, just some awareness there ahead of traveling is important. I already briefly showed you this just in the live version on the website, but all of the variants that are emerging, you can see there's a lot of them. All of those different colors are subvariants of Omicron, and it's good news that they are all still subvariants of Omicron, but there is still a lot of mutation happening, and I like much better that the graph on the left. That's from August 20th, where almost everything is a single type, and we have a few little subvariants at the top. You can see that in recent weeks, as COVID transmission has picked up some more across the country, just as it's gotten colder, every time the virus transmits, that's when it has a chance to mutate. And so we are seeing more and more of these mutations. But there's not any that I'm hugely concerned about just at the moment here. It's more just that we continue to see lots of subvariants. COVID is definitely not done with us. And variant proportion in the US, again, nothing really standing out here. I also wanted to just briefly talk about just a little more about kind of how the mRNA vaccines work, but then specifically, we've gotten a number of questions about, why do I need an updated booster? What's the science behind that? So I thought I would just remind you very high level. So, this red with the little spikes, that's a drawing, not an exact drawing, of course, but of the SARS-CoV-2 virus. And then it has all of these little spikes coming off it, right? That's why it's called the coronavirus. Corona means crown. And the virus kind of looks like a crown because it has all of these spikes. That's what makes it really different. Our cells, human cells, don't have any spikes on them. So the spike proteins are a very good way, if you can teach your immune system that if it sees something that has spikes, like the SARS-CoV-2 virus, that's not human. We should fight that off. That's kind of the basic idea. And so inside the SARS-CoV-2 virus, there is messenger RNA, which is basically kind of the genetic code, you can think of it. And the way it works is the mRNA tells the cells, meaning your cells, to make a spike protein, to make a specific part of the SARS-CoV-2 virus. Not the part that makes you sick, not the part that causes any problems, but the part that lets your body recognize an intruder. And then the immune system produces antibodies. Antibodies are these blue, kind of Y-shaped, or the yellow, it's the Y-shaped ones. And there's a lot of science that goes into this, but basically these antibodies are designed to very specifically be able to identify parts of a virus. In this case, it's very good at identifying the spike protein. And so first you make antibodies, and then a little later you make these T cells. And the T cells are the other part of our immune system. But together, the goal is to destroy any spike protein. So if COVID-19, if the SARS-CoV-2 virus comes into your body, your immune system, because it's already learned the lesson, it has antibodies and T cells because of getting the vaccine, it can quickly work to identify and then destroy the spike proteins, which destroys COVID, and therefore you don't get sick or you don't get as sick. And so the idea is if you're exposed to the virus in the future, your immune system, meaning these antibodies, these Y-shaped colorful things, and then your T cells can very quickly recognize the spike protein, and right away the antibodies and T cells can start destroying the virus. So the whole point of the updated COVID-19 vaccine is that the spike protein itself has mutated quite a bit since the original SARS-CoV-2 virus. And that's not unusual to see a virus continue to mutate as it spreads. But Omicron, for example, had more than 30 changes in the way the spikes kind of look. There were 30 changes in the genetic instructions that the virus uses to make the spike. And the whole reason that the virus kind of changes a little bit the way the spike looks is because your body, if you don't have antibodies that can recognize the spike well, it won't, the COVID can get in and it can start multiplying more before your body necessarily recognizes it. So the whole reason to get the updated COVID-19 vaccine is that it's been slightly adapted to help your body better recognize the way spikes look now on COVID. So in Omicron, the spikes look a little different. And so when you get the vaccine, like I did today, it teaches my body how to make antibodies and then eventually T cells that are a better match against the spikes, if that makes sense. And so the idea is if I'm exposed to the virus in the future, I've already got antibodies and T cells that have been designed to identify and then quickly fight off the updated version of the virus, meaning it can find the spikes better, it can attack them. And so I'm better protected against not just BA4 and BA5, but all of the mutations that have gone into Omicron, for example. And some of the mutations in Omicron are the same mutations that were in Alpha and Beta and Delta. So the updated vaccine really is different. It's the same technology. It's got the same safety profile, but it's teaching your body to better recognize the way that the virus has mutated and changed. So I hope that helps answer the question a little bit. How are we doing on bivalent boosters? Still not that well. Across the whole U.S., just 11.3% of the population over 5 has had their fall 2022 bivalent booster. And here in Chicago, we're still not even at 15%. Only 14.4% of those over 5 as of last week. And even if we look at those over 65, just 30% of Chicagoans over 65 have had their fall 2022 booster. That is not enough. I'm really quite concerned heading into this fall and winter that only, I'm concerned all the way around. This is not enough for population level immunity, but especially for those over 65. That means about 70% of our most vulnerable Chicagoans to severe outcomes. Those over 65 are the most likely to be hospitalized, the most likely to die, the most likely to have the other underlying conditions. It's especially important that these folks come up to date because when you have the vaccine, your antibodies kind of are better and act faster, but then you also have T cells that can help come in and fight off that virus if you do see it, less likely to make you seriously ill. So we're making progress, but I am worried, I have to be honest. We are at more than 387,000 doses of the updated boosters to Chicagoans. That's up from 350,000 last week. We're doing about 4,500 a day right now. That's that red line. And if we just look at eligible Chicagoans, meaning those who had their previous vaccine and then have had their updated fall 2022 COVID booster, only 21% of those folks, up 2% from last week, have had that booster. So I now go in this list. So I will slightly help these numbers, as will everybody else who is getting their COVID vaccines right now. But you can see that by race ethnicity, not even a third of eligible white Chicagoans, less than a quarter of eligible Asian Chicagoans, less than 20% of eligible Black Chicagoans, and less than 15% of eligible Latinx Chicagoans have had that booster. And that's part of why we did the vaccine event down in a heavily Hispanic or Latino neighborhood today, because that's the group that in a lot of ways has been has been very, very hard hit, but the booster uptake has lagged, and I worry about that. And then if we look by age, the 70-year-olds, 70 to 79-year-olds are doing best, but they're only 40%, not good enough, and we have a long way to go in all age groups. About 69% of Chicagoans have gotten their vaccine in a pharmacy. It has been the most likely place to get a bivalent fall 2022 booster, followed by outpatient setting, hospital, FQHC, and so on. And if we look by race ethnicity, every race ethnicity group has also been the most likely to be vaccinated in a pharmacy. You can see about 82% of white Chicagoans, about 47% of Latino Chicagoans, 46% of black Chicagoans, and so on, have been vaccinated in the pharmacy. Black Chicagoans next most likely to be vaccinated in outpatient settings, followed by hospitals. Latino, actually most in green there, FQHCs, federally qualified health centers, the next most likely place to get vaccinated, followed by outpatient. So all of these, it is widely available, it is free. Some of our activities are in that other category, as well as public health as our immunization clinic specifically. So we are standing up. We're continuing to do these on Saturdays. So this weekend for Thanksgiving, we are not running a family vax clinic because of the holiday, but the following Saturday will be at Wright, December 3. We continue to do hundreds, in many cases more than 500 vaccines at these events. So we'll keep them going. You can get your flu vaccine, you can get your COVID vaccine, your primary series, your bivalent boosters for all ages. And I encourage you to come out here. It's entirely free of charge. And just a reminder, we continue to operate our Protect Chicago at Home program. You can get your updated COVID booster, you can get your flu shot at home. In-home vaccination is available to all Chicago households at no cost, no questions asked. If you live in Chicago, we will come to you. Up to 10 people can be vaccinated. Invite your family, your friends, your neighbors to get vaccinated together. Because of the way the funding works, at least one person needs to get a COVID vaccine of some kind for everybody to get flu shots. So, but we are otherwise able to do these together, which we're pleased about. Everyone aged 6 months and up is eligible for the at-home program. We're currently offering appointments Saturdays, Sundays, Mondays, and Tuesdays from 8 a.m. to 6:30 p.m. So give us a call, 312-746-4835, or come to chicago.gov/at-home, make an appointment, and we will bring it to you. You'll also see there's a Travel Healthy campaign that launched this week. You may see it on social, in Ubers, on modes of transportation. It's really aimed at both travelers to Chicago and travelers from Chicago. What are things that you can do to limit your risk while traveling? And so just as a last-minute reminder, you might think you're up to date with your COVID vaccines. If you haven't been vaccinated since Labor Day, though, against COVID, it's time. So previously vaccinated Chicagoans age 5 and up are eligible for the new booster, which gives you the best protection against Omicron. As always, there's our website, there's our phone number. Still free for all. That may not be true next year, but right now it is still free for all. And we will work hard to keep it free for everybody as much as we can. But for now, it is still free from the federal government at pharmacies, doctors' offices, pop-up clinics, standing clinics, at home, etc. So please do get your vaccine. All right, let's go ahead to your questions. I'm going to end this. Okay. Deborah Lynn Harris from Facebook says, a friend got diabetes and COVID, which she got before the vaccines came out. Yeah, the vaccines are important to stay healthy, especially after 50. I totally agree, Deborah. And thank you for raising the diabetes. I showed some data last week from some Chicago data here specifically. We looked at who is getting seriously ill still from COVID here in Chicago, who is dying, who is being hospitalized, and age is the clearest risk factor. People who are, we've had people from their 40s through to their 80s die of COVID here in Chicago in the last 6 weeks, but especially those over 80, followed by those over 70, those over 60, are definitely at higher risk for severe outcomes. But besides age, it really is underlying conditions that are of the most concern, and that's especially anything that compromises your immune system, and diabetes is right up there with it. So if you don't know, diabetes diabetes really affects a lot of your organ systems, but it also affects your immune system. And so we've seen right here in Chicago that people with diabetes in particular more likely to get seriously ill. Also people with immunocompromised conditions more likely to get seriously ill or even to die. So those who are over 50, those with diabetes or other immune conditions, the most important to stay up to date with that vaccine. So thanks for that comment. Tiffany Hagstrom from Facebook, is RSV starting to decline? Also, I read that a flu strain looks like it might have disappeared. Can you give us any information about that? Okay, so Tiffany, I showed that graph about is RSV starting to decline. It does look, at least in terms of hospitalizations, like it might just be starting to decline here, but it's still incredibly high. Even right now, much higher than it has been at any point over the last couple of weeks. So we're keeping a close eye on it and trying to have it come under control, of course. But yes, it looks preliminarily like it might be starting to decline, but it's too early to call that for sure, and it remains very high. And to the question, I read that a flu strain looks like it has disappeared. So influenza has been with us potentially forever, but influenza has been with us in a pandemic kind of way. If you think back, 100 years ago to the 1918-1919 flu pandemic. As we developed vaccine technology, every year, the way this works is they'll make a vaccine that is the best match possible to the strains of flu that were circulating at the time they're making the vaccine. So the way we actually do this is we look in the southern hemisphere, because the southern hemisphere has winter when we have summer, and they have summer when we have winter. And so the scientists in the US, for example, look at all of the strains or the variants of flu that are circulating. There's flu A, there's flu B, those are the biggest divisions, but then there's H1N1, if you've heard of that. That's a strain of flu, for example. And then we make our best guess. We say these are the strains that were circulating the most in the southern hemisphere, and we make a new vaccine every fall that will help fight off those strains. The scientists in the southern hemisphere do the same thing. They look and see what is circulating in our winter, their summer, and they make a vaccine that is the best possible match. So we see strains of flu regularly go up and go down, and sometimes some will be really dormant. Is it possible that one has completely gone away? It's possible, but I think it's more likely it's just dormant and quiet this particular season. That has had 100 years or more, even just since the significant pandemic, to continue to evolve and emerge. And we don't see strains completely go away usually, but we will see them be dormant. So the good news is that this year's flu vaccine is looking, in the early data here, it's looking to be a good match, meaning that the flu strains that people are getting, especially down in the Southeast and here in Chicago, are matched well to the vaccine that was made. So there's no such thing as a 100% match. There are more strains of flu than you can get into the vaccine every year, but it does look pretty good. So that's what I would say, that overall, we've learned a whole lot about how to protect people against flu by trying to stay ahead of the variants. And we've taken that same idea now with COVID this fall. So thanks for that. Amanda DW on Facebook says, I have a 3-year-old who has had lots of colds and viruses, but not sure if it's RSV yet. Will she be better able to handle it, better than if she got it younger? So, Amanda, yes. Chances are very, 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 very good, almost 100%, that your 3-year-old has already had RSV. RSV, we'll just talk about it for a second. It stands for respiratory syncytial virus. It's a very common virus. It usually causes the common cold. People think, the cold is caused by one virus. No, lots of different viruses cause the cold. In fact, there's a version of coronavirus that causes the common cold. Prior to SARS-CoV-1 and SARS-CoV-2, other strains of coronavirus have historically just caused a cold. But the point is that basically everybody gets exposed to RSV. By the time they're 3, it's something like 100%, honestly, have had RSV if you do a study. I mean, especially if your child has had plenty of colds and viruses, chances are pretty much 100% she's already had RSV, or he. Where we see concern, and adults, by the way, also continue to get exposed to RSV and may have it even every year without it causing significant illness. The biggest problem with RSV is that in the very youngest children, and then also in really older adults, or adults with significant immunocompromising conditions, it can be a bigger deal. So in the kids, even, a lot of you maybe feel like you're only hearing about RSV for the first time right now, but, I'm a trained pediatrician, and RSV is, forget COVID, RSV is the #1 disease that puts children under 1 in the hospital with respiratory viruses, with respiratory illness. And it's just because airways are very small in the youngest kids. It doesn't take that much inflammation. The kids can really, have some trouble breathing. And so it really is the very youngest kids that we worry about the most. And I would say by the time kids are 3 or 4 or 5, they've pretty much all seen RSV before. It doesn't mean that you can't still potentially get pretty sick. I don't want to say it's not 100%, but for the most part, a 3-year-old, I wouldn't have major concern for a big new RSV infection. One of the reasons we've had so much trouble with RSV this season is that over the last few years, because of the pandemic, we've appropriately been very cautious, right? We've been doing a lot of things that protect against COVID also protect against other respiratory viruses. So all of that hand washing, really good for RSV. And let me just say that again, if you have a young child and you're worried about RSV, hand washing is critical. The sort of surfaces play more of a role for RSV than they do for COVID. But the masking that folks have been doing, keeping your germs to yourself, those help with the other respiratory viruses as well. The distancing, the staying home when you're sick. And so right now what's happening is we're seeing kids under 1, which we see every year, but we're seeing kids under 1, kids under 2, even kids under 3, many of them only seeing RSV for the very first time. And so there's a lot of kids only now sort of learning that first immune lesson from RSV. Children who are premature or who have heart and lung conditions, there's not a vaccine, but there actually is a medicine that can give during RSV season that doctors can give those kids to basically give antibodies. It's sort of an indirect way of giving that immune protection, just because those kids are at highest risk. We worry the most about children born prematurely. So, and that's where I say, everybody 6 months and up needs a flu shot, needs a COVID vaccine, because we've got to make sure the vaccine preventable diseases are under good control, because we don't have vaccines against a lot of the more common viruses, which are going strong right now. Sarah Garza from Facebook, how long should you wait after recovering from the flu to get the updated booster? Good question. So you do not have to wait at all. And actually, I wouldn't really recommend waiting. I would recommend waiting until you're recovered, right? So if you have flu and it takes you a week, week and a half, even 2 weeks to really feel like you're totally over it, I generally don't recommend getting a vaccine when you're already not feeling well. Not because it won't work, but just because you're kind of revving up your immune system at a time that you're already not feeling all that well, and it can make you feel even worse. It can make the side effects be stronger. It's not dangerous, so there's no definite waiting requirement. But I would say, if you've just had flu, we really don't want you to get COVID, right? And so I would recommend really as soon as you're feeling better from flu, go get your COVID shot. Same thing for COVID. If you get COVID and you haven't had your flu shot, as soon as you're feeling better from COVID, go get flu, because we don't want to see people getting these at the same time, which can happen. And these viruses are not related to each other in any way. So when you get a flu vaccine, you haven't done anything to protect yourself against COVID. And when you get a COVID vaccine, you haven't done anything to protect yourself against flu. So you really do need both of those vaccines. So good question. I would say once you're feeling better, go get your updated booster. Join Morg on Facebook has a number of questions here. So he or she is asking, does city employees need a booster? When is a vaccine passport going to start? And why are the unvaccinated not getting COVID? Okay, so lots of questions joined, but we've got a little bit of time, so let's take them. Do city employees need a booster? They do not need a booster in a required for work kind of way. There could be exceptions to that if there are, for example, people working in healthcare settings, et cetera. But by and large, there is not a requirement for city employees to need a booster. And when you say city, I presume you mean City of Chicago employees, people like me who work for the City of Chicago. There may be employers out there, not big C City of Chicago, but just people in Chicago who may have chosen to require getting a booster. I went to a conference a couple of weeks ago and they required people to show that they had had a booster. So there may be settings that have a booster requirement, but we have not required the booster for big C City of Chicago employees, and we have not required it across the city. I think there's a couple thoughts around that. We know that getting those initial vaccines is the most important thing for preventing severe illness, and we see breakthrough infections. And so when we're deciding when do you do requirements, we're really thinking about sort of risk benefit. And in the setting, I do worry a lot about city employees who have not had their fall 2022 booster. The Chicago Department of Public Health, we notify our employees every single time somebody has COVID. So I am well aware of what's happening, and we continue to see COVID, and we continue occasionally to see serious COVID, especially in people who haven't had that fall 2022 booster. But we've not made the decision to mandate it at this point. So that's your first question. When is a vaccine passport going to start? I don't know what you mean exactly by vaccine passport. If you mean is there an electronic version of the vaccine card? Yes, there is. If you were vaccinated in Illinois, you can go. We have details on the website for how to do this. You have to give some information so that your identity is validated, because not just anybody can get this information. But you can download electronically your own vaccine records should you want them. They're also available usually electronically through the wherever you got vaccinated, whether that's a pharmacy, the doctor's office, et cetera. So if that's what you're referring to, it already exists. I don't anticipate there being yet sort of an electronic version that will be universal. I think there are conversations certainly about how do we do a better job in this country of making sure that the immunization registries talk to each other. This has been a struggle the longer COVID has gone on. If, for example, we have some folks in Chicago who winter in Florida, right? We have some snowbirds. If those folks in Florida got their COVID vaccinations in Florida, their information is in the Florida registry, and the Florida registry doesn't talk to the Illinois registry. So there's been some thought of how we make sure top priority is protecting individuals' information. The CDC never gets your name of whether you've been vaccinated. We don't report any of that. They're just interested in, the numbers overall as we're looking at the public health. But at the individual level, it can be a little frustrating for folks who are, needing to go to school, for example, and have lived in different states. It's harder, I think, than it should be for you to get those own vaccination records back. So there's some thought about are there ways that we could better make sure that vaccine systems across this country talk to each other. And so IDPH is the Illinois Department of Public Health. VaxVerify is the name of how you can download your record. So I hope that answered the question. And then Join Morg from Facebook. Why are unvaccinated not getting COVID? So I don't know who that is unvaccinated that has not had COVID, but I can tell you there are not a lot of unvaccinated people who have not had COVID. If you look at I'm going to pull this up real quick because we have a second. Can you pull the dashboard back up for me, please? I want to show you this graphic here at the bottom, this vaccine effectiveness. If we click on this is all Chicago data. And we have cases, hospitalizations, and deaths here. So it defaults to deaths, and let me just describe this to you. The red line are unvaccinated Chicagoans who die from COVID-19. The light blue line are fully vaccinated Chicagoans who die from COVID-19, and the dark blue line are boosted Chicagoans who die from COVID-19, so vaccinated and boosted. And you can see that in the red line here, this is from the beginning of the COVID outbreak, those who are unvaccinated have been much, much, much more likely to die. See this? And then we put some details in here that, like, just since the Omicron variant became dominant, unvaccinated Chicagoans were about 6 times as likely to die from COVID as compared to people who were boosted. So this is the pattern. Here's what the Chicago data looks like for hospitalizations. This is even stronger, where, this was our big Omicron peak last January. This was the context in which we briefly, we had a mask requirement in for the city, but we also put a vaccine requirement in for higher risk settings because of this. Our hospitals were full, and it was largely being driven by Chicagoans who were not vaccinated. So much more likely to both die and be hospitalized if you're unvaccinated. But I think your question is about cases. And even there, this is our rate of COVID-19 cases by vaccination status. And in red, this is unvaccinated Chicagoans, vaccinated and boosted. And so just since Omicron became dominant, unvaccinated Chicagoans are about twice as likely to test positive for COVID compared to those who are boosted. So I will tell you that, public health looks in terms of sort of these statistics, and I can tell you that it is by far the most dangerous in terms of likeliness of getting COVID, likeliness of being hospitalized, likeliness of dying if you have not been vaccinated. We can come back off that, but I think. There is also, we've done, there have been these serology studies where you look to see have people seen COVID. There is virtually nobody left in Chicago who has not had an immune lesson from COVID. They have either been vaccinated against COVID, which is the safer way, or they have had COVID and recovered, or both. But we are definitely seeing people get reinfected with COVID, and they are more likely to get reinfected with COVID if they are not vaccinated, followed by if they had original vaccine but are not boosted, followed by those who are boosted. No such thing as a vaccine that's 100% protective, but it is the most important factor. And all those graphs that I showed you, those are regardless of whether somebody had COVID before, right? So sometimes people say, I've had COVID, I don't really need a vaccine anymore. Nope, like those, we on purpose do not correct for if people have had it before. That's purely about vaccinated versus unvaccinated. So that's really why we promote vaccine. Sometimes people say, you push this so hard, you seem like you get money. We do not get money. The health department does not get money. And in fact, we spend millions of dollars promoting vaccine. The reason we do it is because vaccine is the thing that keeps people. It's not 100%, but it helps protect you against COVID, and more importantly, it keeps you out of the hospital, it keeps you from dying, and that remains statistically true even when you factor in those who have recovered from COVID. So thanks for those questions. Carrie Sims from Facebook. Do you anticipate a large COVID outbreak since the majority haven't gotten their booster? Carrie, my crystal ball. So here's what I'm worried about. Every single time COVID spreads, that is when it has the chance to mutate, right? And so when you get your booster, most people are thinking about themselves, right? You get your booster, that's going to help you stay out of the hospital. It should help with getting infected. It makes you less likely to die. It's really good protection for you first and foremost. It is also clearly helps protect your family, right? If everybody gets vaccinated, et cetera, you're creating some more immunity. But people don't often think about the population health level of this, that when you're getting your booster, when you're teaching your body to better recognize and fight off the mutated COVID virus, those Omicron viruses that are out there, that means that the virus, if it takes hold in your body, that is also a chance for it to mutate again. And the big question mark, the big question mark for this fall and winter is, do we see a new variant of concern emerge? Remember, a variant of concern is not just a subtype of Omicron, but it's one that gets a new letter of that Greek alphabet because it's different enough that it is behaving differently, that we're not seeing people have some continued level of protection from what comes before. And so one of the reasons we need everybody to get boosted, yes, it's for yourself and for your family, but also it's our best bet against sort of stopping Omicron from continuing to be able to mutate. And you see in those graphs that I show, it is mutating quickly. Thankfully, it's all still been Omicron. And if it all stays Omicron, for the next few months, we will see a surge. Like, I have no doubt, because it's a respiratory virus and we always see a surge. But hopefully it'll be a smaller surge, right? Something that's manageable. What I really, really, really do not want is a repeat of the Omicron fiasco, right? From last winter, the worst that hit us yet. And that was because a mutation emerged. So I am very concerned that so many people have not had the booster, that at the individual level, there's a much higher chance that we could be threatening our healthcare system, for example. And if we were to see that, right, that's when we really have to start thinking about, mask requirements, or even potentially, vaccine booster requirements, depending what the data look like. I hope we never have to do that again. But if we started to really see our hospitals overwhelmed, that would be something we would do. I think that is most likely to happen if a new variant of concern emerges. And the way we protect against new variants of concern is having everybody vaccinated. So I know that's a convoluted answer, but I am hopeful that we will not see a large COVID outbreak, but it all depends on what happens with the variants, and the variants themselves are impacted by what happens with boosters. And I do know for sure that there will be unnecessary deaths and unnecessary hospitalizations this winter in Chicago because people have not had their updated booster. I know that for a fact because it's already happening, and that just makes me sad. So I worry the most about those sort of individual level stories of people ending up in the hospital and ICU and even dying just because they didn't realize or hadn't taken the time. But at the population level, I worry the most about new variants, and the vaccine also should help protect against that. Thomas Patrick on Facebook. I'm wondering if you can show a graph with people that have suffered from blood clots due to the shot or boosters. I know 4 or 5 people that have been hospitalized due to vaccine or died due to vaccine injury. Thoughts? Okay. So I don't have that data here with me right now, but I could bring it next week if you're interested. COVID itself, it turns out, really messes with your what's called coagulation system. That's the fancy word for clotting. So there is a slightly elevated risk of blood clot in people who get the vaccine. However, there is a dramatically higher risk of blood clot in people who get COVID. And so I'll pull some data for you on this just so we have it. It is not at all common. Okay, you hear that? It is not common for people to get a blood clot after getting the vaccine, although it can happen. Blood clots are probably more common than people realize anyway. And there's this funny phenomenon where people, I think, no matter what happens to them, there's a tendency to want to think that it's related to the vaccine, which is why we do these large studies. And so they will now, when you do the questions around vaccine, and even as we've thought about dosing and all of this and learn more about it, clots have been one of the things that we've looked at. But the risk of getting a clot during or after COVID infection, dramatically higher. And in fact, we've seen a lot of deaths due to clots after COVID infection. So I'll bring some data if you're interested in that on the next time. So thanks for that question. Colleen Parsons from Facebook says, I asked questions last time and didn't get answers. I don't think I've seen your question before, Colleen, but that's okay. We'll take it. Or maybe it's Colin Parsons. Will you answer questions about side effects or payouts for vaccine damages and the fact that we were told these would do what they have not to date? The fact that we were told these would do what they have not to date. I don't completely, okay, I'll try to answer that. So first of all, there has never been a COVID vaccine. There has never been a vaccine studied like the COVID vaccine has been studied. We've given more than 12 billion vaccines around the world, billion with a B. And the number of sort of studies and follow-up in real time has been higher with this vaccine than anything else. The vaccine remains highly, highly safe and highly effective, especially against preventing severe illness. If you're wondering what they haven't done, meaning that they would completely prevent COVID, no such thing as 100% protective COVID vaccine, but also Omicron was when we really saw the vaccine, we started to see more breakthrough infections, meaning people who had had COVID before still getting sick. Luckily, like in the graphs I showed you right here in Chicago, still incredibly protective against those severe outcomes, but we have seen more breakthroughs. That's part of why the vaccine has been updated this fall to try to help ideally with some of that. There is a significant system. If you go to the CDC website and take a look at this, there is a system where every single time anybody has any suspicion for an injury or a problem related to any vaccine, it's reported. Whether or not there's a scientific link, whether or not it's a doctor reporting it, whether or not, like, they keep track of all this to be able to do the studies and look at that. And then there actually is a fund that if there are concerns around sort of vaccine, there's a whole process that's attached to that. So I will refer you to the CDC website to read some more about it. And then if you have additional questions after that that are more specific, feel free to bring them. But there's not been anything surprising in the side effect. The most common side effect after getting a COVID-19 vaccine is no side effect at all. The next most common by a mile is a sore arm. A small number of people have a day or sometimes even 2 days of really feeling under the weather, sometimes having a fever, like some people have a robust immune response. I'd say the only thing that emerged that didn't even show up in the trials because it's so infrequent was some of this concern around myocarditis. That's that inflammation of the heart muscle that occurred in a small number of especially younger men. That's part of why they've changed the dosing, they've changed the spacing, but that's not a long-term condition. It's just that when the immune system was revving up, we saw particularly some younger men have this condition. And so there's that's been incorporated sort of into the language and even into some of the dosing related to that. But we've not seen that be common, and we've not seen that. We generally saw people recover from that, but that was an example of a side effect that was reported that actually, when they went back and looked, slightly higher. Still, the risk of just like clots, the risk of myocarditis much higher if you get COVID infection than COVID vaccine. But I'd say that was the one thing that was found in the post studies that was somewhat unexpected, but things have been adjusted as a result of that. And definitely, if you're just like blood clots, if you're concerned about blood clots, you're concerned about myocarditis, you really don't want to get COVID, meaning you want to get the vaccine. Tony Laporte on Facebook just has he says, thank you, doctor, and your team for all your service. Thank you. It was actually Thank Public Health Professional Day, or Thank Public Health on Monday of this week, so appreciate that. Join Morg back on here one more time from Facebook. What happened to monkeypox? So monkeypox, go to chi.gov/monkeypox or chi.gov/MPV. You will see that it is not gone, but it is much, much lower. Maybe I'll pull that up real quick too. Can I get the team to, just so we'll look at it real quick in real time? So chi.gov/monkeypox, you can go and see exactly what's happening. That's the number you can call if you have questions. But then our let me just get this here, data dashboard. So if you go to our data dashboard for monkeypox, let it load. We're updating it Mondays and Thursdays at this point. So do you see, this is what's called an epi curve. The beginning of our outbreak here was in June. You can see it spiked where we were having about 140, 142 Chicagoans diagnosed each week in August, and then has tailed back down. It's not gone though, right? We're seeing 3 to 4 to 6 to 14 per week over these sort of October, November. So we continue to vaccinate. You can see we've had 1,100 cases in total, 72 Chicagoans hospitalized, 3 Chicagoans die from monkeypox. Those tend to be people with other significant conditions like immunocompromise. And so we are very much still vaccinating. These are the details about our monkeypox cases. So still has been very heavily concentrated in gay, bisexual, and other same-gender loving men. We recommend that all gay, bisexual, and other same-gender loving men, as well as all transgender individuals, get vaccinated. Here's what's happening with vaccinations. We've done about 45,000 vaccinations. You can see those have tailed off as well, but we're still doing a good number of them. Everybody who's eligible should get 2 vaccines, and these are the details of sort of who's been vaccinated if you want to explore. So that's where you can go. We continue to update that twice a week, and you should get monkeypox vaccines if you have not. But generally, I'm relatively pleased with how this is going, but it's not gone. And so for people who are at increased risk, we definitely want folks to get the vaccine. Good question. All right, we can take that down. And I think we are probably just about at time, and we got just about everybody in. Maybe I'll take one more here. I see Liz on Twitter is saying, can we talk about how countries like Denmark aren't offering the COVID vaccine to kids? While she says, we're trying to force boosters on kids. What are we doing? So there are some countries that have decided to, vaccines are expensive for governments to purchase. And there are countries that have decided with limited resources that they are going to fund vaccines only, for example, people over 30, or even in some countries, people over 50. It is more protective for all ages to get boosted. But to be honest, in the US, we've seen a relatively small number of kids choose to get that booster, meaning that there have been a lot of dollars spent on vaccine that has not yet been used. And so there are countries, I think, that are looking for that and trying to stretch their public health dollars. But there is no country that has said children should not get vaccinated. It's just basically, is the government going to cover it and pay for it? And most of the world has a national health system, unlike the US. So I would say, and first of all, I do just, are we trying to force boosters on kids? Nobody is forcing boosters on anybody. But every age group, including children, kids are more likely to be hospitalized and more likely to die, although the chances are lower, thankfully, among kids, if they are not up to date with vaccines. That is just a fact, and that is why we continue to strongly encourage boosters for kids. We also know that children, who thankfully are so much less likely to get severely ill, we know that children are around their parents, their grandparents, their neighbors, their immunocompromised friends. And so, all of my nieces and nephews are up to date with their vaccines, including boosters, including going all the way down to the very youngest ones. And it is absolutely what I recommend because it is best for them. It is best for their families. And I'm glad, frankly, that at least for COVID, this country has decided to cover the costs of vaccination for all ages. If I only had limited vaccine available, I would choose to prioritize the oldest Chicagoans. That is the right thing to do. But protecting older Chicagoans also means making sure that younger Chicagoans can access vaccine as well. So that is why we continue to promote vaccines. We are not forcing vaccines for anybody. But I would hope that people who, part of the reason I show you a lot of data here and a lot of local data is that I want you to really see what is happening here in Chicago. And we see that the vaccines, you can look at those same graphs, by the way, those vaccine effectiveness graphs. You can look at those by age group if you want. They're on the website. We do that because we want to be transparent. And I am worried about the kids because our hospitals are already nearly full, and we haven't even really hit influenza or COVID season in a serious way. So I am pleased to be able to offer vaccines to all ages for free. I wish I could do that for every vaccine always. And I encourage all Chicagoans over the age of 5 to get that updated booster this fall. So thank you so much for all of your questions. If we didn't get to it, We'll try to get to it next week, but thank you, and happy Thanksgiving to all of you. I hope if you're gathering, hopefully everybody who is gathering is up to date with vaccines, but whether or not you are, remember that if anybody gets COVID, they should take medication. There's a medication called Paxlovid that you take it in the first 5 days. You can get it at a doctor, you can get it at a pharmacist, that really helps prevent those severe outcomes. While you're gathering, ventilation is good, crack the window a little bit, be outside if you're meeting up with folks in a warmer climate. Definitely be doing some of the hand washing. Think about if you're getting together with people who are older or immunocompromised, maybe just have everybody do a COVID test. It's a good way to have an extra level of protection before you're gathering. And then if anybody is really feeling pretty sick, they really should probably skip the festivities if there's somebody who's at high risk. But if everybody's vaccinated, especially, COVID does not need to be top of mind with your gatherings. And I feel like that's the first year that I've been able to say that in a serious way. And that is thanks mostly to vaccines as well as treatment. So happy Thanksgiving to everybody. We will be back next Tuesday at our regular time, 11 a.m., to keep answering your questions. Thanks so much. Bye-bye.